It looked like the last question was why get treated at Penn Medicine? Why at the Penn Mesothelioma and Pleural program? I think we should each speak to that. I'll start off with one word: passion. Make that two words: passion and teamwork. We hate this cancer. We eat, sleep, and breathe mesothelioma, thinking about how to do it better. Not only are we meeting in the clinic, we have laboratories. We have one of the longest track records of actually inventing treatments, the things Dr. Sturm were talking about, bringing the cancers, bringing the treatment to the clinic and treating the patients. And we're trying to make a difference. And, you can see it's all about teamwork. When you don't have an answer for a problem, working as a team is your best way to try and beat it. And it's all about the patient here.
Dr. Ellie, why come to Penn Medicine for your mesothelioma care?
Yeah, I think experience is one other aspect of this.
Third word,
experience. This is a rare disease, as we've said. In the community, a medical oncologist may see one case a year. And unfortunately, I see 3 or 4 new cases a week, and it's a disease that is rare, and experience matters with this disease.
Dr. Simone?
Yeah, I think echoing teamwork and also options that we have. I think unlike pretty much any other center, I mean, if you think about how rare this disease is and how many different options we have, so whether it's one of the few centers in the world offering proton therapy for the radiation or combining surgery with photodynamic therapy, a novel way to treat the tumor, with so many different types of immune therapies that are really on the cutting edge, leading the worldwide front in that regard, with both Dr. Alley, Dr. Sturman. The surgical expertise, and we've talked about one of the reasons to use radiation is having disease left after surgery. We really don't see that with Dr. Freeberg. I mean, there are cases where we look at it and we say there's no way he's going to be able to remove all the tumor, and he does. So with this team and with the options that we have, I think patients have a great experience, and we have options. No one person in our team predominates. We do what's best for each and every patient.
I echo all the things that my colleagues had said, but I want to just finish with a couple of things, which is that one of the remarkable things is working with all the other components of the Abramson-Cancer-Center. We have some of the greatest minds in cancer medicine, in basic science, in translational science, who are thinking about treating cancer as a whole and then applying those to mesothelioma, and we're able to translate what they're doing in the laboratory to what we're doing in patients. So, for example, we have probably one of the world's largest programs in taking patients' own T cells, their own white blood cells, and modifying them and readministering them to treat cancers. It's some of the greatest successes to date in leukemia and in lymphoma, and we're now applying that to mesothelioma, and we're probably one of the 2 or 3 places in the world that's doing that right now. You can have that kind of cutting-edge experimental therapy at Penn Medicine. You can't get that elsewhere, and I think that combination of science, the passion, the experience, the teamwork is really what makes us special, and we think that you should get your care at the Penn Mesothelioma and Pleural program.